and let me thank for the invitation. So first of all, I'm going to talk about a diagnosis more than a treatment, with particular reference to the squamous neoplasia. So the main issues we encounter when we approach these neoplasms is have to do with diagnosis and monitoring. We don't know when we treat, especially in topical chemotherapy, whether the tumor has disappeared, whereas there are residual tumors or metastases. Okay, first of all, diagnosis. Diagnosis is based essentially on clinical features. These are the three most typical presentations or pictures of this neoplasm. The gold standard, however, remains the excisional biopsy and then histopathology. The clinical feature can be sometimes misleading. So the positive predictive value is 54%. So this means that if we try and make a diagnosis, probably we are successful in less than 50% of cases. So you may see here a pterygium, and the percentages, also the likelihood that this may actually be a neoplasia varies a lot depending also on the geographic area. This might look like a post-infection glaucoma. Actually, it is an in situ carcinoma. This might look like a carcinoma. Actually, is a scleral involvement, juvenile, and this is a fibro histiocytoma of the conjunctiva. So the features are not always indicative, and this is an onset from the upper limbus that had been there for some months. Actually, it was due to a foreign body for more than 3 to 4 months. And then another case which might look like a scarring post-infection conjunctivitis actually was a bilateral HPV correlated squamous neoplasm. And here, biopsy can certainly help us, not necessarily by means of incision, because you can also remove a very small portion of the tumor tissue at the slit lamp. So cytology can be made by exfoliation with a brush or a spatula, and impression or impression cytology. The value of the cytology has a specificity and sensitivity around 80–90%, and so we may visualize or so study the deep layers. We cannot differentiate between the dysplasia, the grade of dysplasia, or invasive tumor. So recently, the OCT of the anterior segment has become available. Several papers have been published on this, identifying some typical features at the OCT, so like the epithelial thickening, hyperreflectivity of the epithelium, and this abrupt transition from normal to abnormal. So sensitivity and specificity are superior or higher than those of cytology, and the advantage is that in this way we can also have sequential monitoring. So sequential images at the OCT of patients that have been treated with chemotherapeutics actually may show a lot, maybe very interesting. So confocal microscopy, in some small case series, we have explored the diagnostic specificity. So typical cytologic features have been identified. The resolution is higher than OCT, but the examined area is very small, and so it requires a lot of dexterity and diagnostic ability. And it has been proved that actually normal conjunctiva from neoplastic conjunctiva can be separated, but it's difficult, or it's not able to differentiate between benign and malignant lesions. Fluorescent confocal microscopy has been used, where the confocal diagnostic ability is enhanced by fluorescent substances. So we have conducted an ex vivo specimen that had been excised, and initially fluorescent confocal microscopy has been used, and then it has been confirmed by standard methodology. So we have included the squamous and non-squamous squamous lesions. And so we have observed that in 15 minutes' time, we could get a response with 100% agreement with the successive methodology as to the nature and the extent of the lesion. So this might be used for MOS, micrographic surgery of the conjunctiva. These are some examples. So the images are more similar to a CT images than a confocal microscopy. So you see the comparison of a healthy epithelium with a dysplasia epithelium, and the similarity between the bioptic spacement and the one obtained with a flash technique is very high in terms of details, and especially the passage from the normal to the cancer epithelium. So this has been excised 9 times previously, and so you may see here that was actually benign. This is a more suspicious lesion. We have a leukoplakia and jelly and fleshy appearance. Here we see that the grading in terms of maturation is completely altered, and also the membrane is altered. This is on carcinoma in situ. This is soft. You may see the normal conjunctival epithelium, but actually it was a conjunctival dermolipoma. As to pigmented lesion, this is an nevus of the caruncle that had grown, and pseudo-tubular structures could be observed, but here might be normal, and it was normal here, but unlike the second lesion involving the cornea as well, here the cells actually formed niches and nests and cords, and it was a conjunctival melanoma. A very last observation concerning the opportunity to monitor these cases over time. So with the anterior segment, current approaches, nothing can be done, but we might use molecular markers. So metalloproteinases, the metrics have been used, which are expressed by the tumor much more than the normal conjunctiva. And so we've seen that these can be considered as the marker of an existing neoplasm, but after treatment with mitomycin, a progressive reduction of the expression of these metalloproteinases was observed, so they might be used in the future as cancer or tumoral markers for the follow-up. Okay, as a conclusion, diagnosis is still largely based on clinical features and post-op histopathology. The anterior segment CT seems to be quite promising in terms of diagnosis and post-op monitoring, but most publications come from a single center, and this is might be a bit suggestive of some suspicious element, and so confocal microscopy had a resolution okay, but it might be operator dependent and low specificity. Potential role for fluorescent confocal microscopy. So we started from in vitro, but now we are moving to ex vivo, and so we will see where the new research will bring us. As to the treatment response to treatment and possible residual disease, we have seen that the anterior segment OCT may be useful, although it is not definitive, but probably or hopefully in the future we will also identify molecular markers.